Hi guys, my name is Melissa Petro. I worked with Molly and Christina on Medicare. I chose to interview my grandfather on his experience with the program. But before I discuss our interview, I'll give you a little background on what Medicare is. Um, Medicare is a federal health insurance program for people who are 65 or older and certain younger people with disabilities. There are 4 parts to Medicare. Part A covers hospital insurance, Part B covers medical insurance, Part C covers Medicare Advantage plans, and Part D covers prescription drugs. We chose to focus on Part B though, which covers certain doctor services, outpatient care, medical supplies, and preventative services. A little bit on my grandfather. He is currently an 82-year-old Caucasian male. He is 100% Slovak and lived in the United States his entire life. He is a high school graduate with some college education from Ohio State University. In 1951, he joined the service and served in the Korean War for 2 years. After the war was over, he worked various different side jobs and later began working as an industrial specialist for 15 years. This was a federal government job, and he worked under the Small Business Administration and the Department of Defense. As an industrial specialist, he would go out to companies that wanted to have a contract with the government to work, make parts for different things, etc. And he would go to various different companies and looked at the way they were doing things and how efficient they were doing them. And his goal was to make sure that they were meeting all the requirements of the contract. So after his visit to a specific company, he would write a report called the pre-award survey of why or why not he thought that they were doing the job correctly and efficiently. And because this was a federal government job, he received health care benefits. They paid for his health insurance, and when it was time for him and my grandmother to retire, they were able to take their health benefits and carry them over into retirement. My grandfather married my grandmother in 1958. They had 4 daughters together, one of which being my mother. They are of middle socioeconomic status. Both my grandmother and my grandfather worked and were able to send all 4 girls to college. My grandfather has a very strong social support network. He's still married to my grandmother, who is alive and well, and also remains very close to his daughters and his grandchildren. He received Medicare in 1996 when he turned 65. He has an overall healthy record throughout his life. Besides having a bit of high cholesterol, his medical record looked pretty good. But in 2011, at 81, he had a bit of a hiccup. One morning, he began complaining to my grandmother that he wasn't feeling well. And she noticed that his speech was off and he had high temperature. So she called the ambulance and he was taken to the emergency room. The doctors ran tests and he was admitted to the ICU. He was in the ICU for 9 days. And during these 9 days, he suffered from high fevers and fluctuating blood pressure. And he was administered different medication to help with these symptoms, and the doctors kept running more tests and did an MRI in order to accurately identify what the problem was. And they came to the conclusion that what was causing these symptoms was the source of a severe bladder infection, and that went undetected for some while. So from there, he was sent to a rehabilitation center close by, and he was there for 3 weeks. And during those 3 weeks, he went to speech therapy for his slurred speech. He also did physical and occupational therapy until he was able to walk again on his own. My grandfather used Part B of Medicare to cover prescription drugs and therapy. Medicare is his primary insurance, and anything that Medicare didn't cover was covered by his secondary insurance, which is Anthem Blue Cross. And Anthem Blue Cross was medical insurance he received from his government job. Kind of switching gears a little bit, one social problem that was going on during my grandfather's incident in the time period of Chapter 11 was and is the financial crisis. And the financial crisis of 2007 to present has affected and will affect Medicare and social programs across the board. With the U.S. being trillions of dollars in debt, it's predicted that lawmakers will likely target Social Security, Medicare, Medicaid, and a host of other social programs. But thankfully, my grandfather was able to get the coverage he needed in the midst of this crisis. And he, and along with my family, are very thankful for Medicare. Without it, he would have had to worry about medical bills and expenses, which could have put stress on him and hindered his recovery at age 81. But he is fully recovered today, and his health is under control at the moment. But it is nice to know that, especially with Medicare, if something does happen in the future, that he will get the care that he needs. So, thank you.